Hi everybody, good morning. My name is Mary and I am here to present Dr. Mikkel Schneider. Dr. Mikkel Schneider is the founder and chief executive officer of Nightingale Education Group, a mission-driven organization focused on innovative healthcare workforce development across the entire professional continua, from certificate programs to graduate studies to reskilling and upskilling through continuing education. From 2012 until 2023, Schneider served as the first president of Nightingale College, a higher learning institute dedicated to closing education equity gaps and creating geographic, socioeconomic, and demographic access to the nursing profession, creating thousands of new nurses throughout the United States. A visionary leader and a registered nurse for almost 30 years, Schneider has a wealth of management experience in post-secondary education for health professions and healthcare delivery services. He's a published academic author, conference speaker, and guest lecturer, specializing in strategic planning, organization development, forecasting, and management. Schneider holds a Master of Business Administration degree from the University of California at Berkeley's Haas School of Business. In 2024, he was awarded an honorary doctorate in nurse education, leadership, and innovation. Dr. Mikkel Schneider.
Thank you. Thanks, Mary. All right. Hi, everybody. Hey, everybody there in the cyberspace. We're coming to you from kind of half sunny, half gloomy Maryland today. We're in Baltimore, and thank you all in the room for coming and spending some time with me here. Sorry about any confusion. For those of you who were confused at all or didn't get the second email upon the first, I don't know how it went, but we were supposed to start, and we're starting on time the way we were supposed to today. So the way it's going to work, everybody, is that we're going to go for a bit over an hour or so, then we're going to pause for a break, and then we'll come back and wrap it up after that. So for the purposes of today, though, you know how you all love watching TV? Maybe, yeah, everybody's like kind of with me. TV online, whatever, yeah, and you know, there are talking heads on TV constantly like, you know, depending on what channel you watch. I mean, they have a lot of words to say about absolutely everything. Okay, fantastic. But no, not fantastic at all. I suggest that you turn the TV off, like drown it. You know, don't unplug and then drop it in a tub. It is not good for your emotional health to begin with, and anything else for that matter. For the purposes of today, what I invite all of you to do, everybody out there, everybody in here, is to put on one hat and one hat only, or rather remove all of the other hats that you have. You know, there is like, I come from a certain political dynasty because, you know, mama was that, and then her mama was that, and her mama's, and on and on and on. So take off. Okay, and take off absolutely everything except one hat. Which one do you think that is? Nightingale hat, being a nurse hat, right? This is the uniting thing for all of us here. I'm a nurse, as Mary mentioned, here in the room, and also the hopefully the profession that you've chosen. Otherwise, you're a little bit lost if architecture is your thing. Okay, so that hat and kind of come from there. Now, so we'll talk about nursing per se today. We will talk about the state of healthcare in the United States. We're going to dig a little bit to figure out how do we ended up in this place that we all experience collectively today, and what it is, most importantly, what it is that you all can do in order to make it change, make it better, sort of ban the unsustainable paths of today so we can arrive at a better outcomes for tomorrow. Hello, ladies. Come on in. Fast and furious. and have a seat and join. Well, don't sit that far. Come join her right there. Okay, so everybody is with me so far? So nursing hat only. Anything that pundits on TV told you, consider it not true unless it is backed by actual evidence. What do we mean by evidence? Those of you who are now in nursing program. Have you, the what? Facts. Facts that come from where? Facebook? No. Insta? No. TikTok? Absolutely not. No. Where do we find actual facts? Scholarly journals. Absolutely. Things that have been published, have been peer-reviewed, and scrutinized to rise to the level of being evidence. Everybody's with me? Everything else is not evidence, right? No matter what, whoever what said, unless you see it published, reviewed. Not good. All right. So everybody, we're together on all of that. Okay. So what is the promise of nursing? Let's start with that. What does the profession promise? Yes. Compassion. So the profession, and speak up, don't worry. That's a great answer. Compassion. Absolutely. Compassion is at the core of it. What does compassion mean? If somebody's compassionate, what does it mean? Yes. Caring for others, right? So it's the ability to empathize, the ability to relate to somebody else's suffering, yeah, and then do something to make it better for them. Yeah, we're everybody with me? That's compassion. Now, who should be included in your compassion versus who should be excluded? I mean, it's a fair question. The what? Everyone should be included. That's the correct answer. The only answer that nursing ever should have is that everyone should be included. If you want to pick and choose the kind of people that you take care of based on what they believe or based on what they look like or based on anything else, the profession is not for you. You will be absolutely miserable. Yes. If your compassion is reserved for only those that look and think and speak and whatever else just like you, it's a losing proposition. And the profession has never, ever meant to be that. So what else is the profession of, it's the promise of compassion and the promise of care for what? In order to do what?
Provide quality patient care.
Provide quality patient care, right. That's the how. We provide the care to get to what? The what? Healing, yeah, better outcomes, health. Everybody's with me? Yes. At the end of the day, it is about wellness, it is about health, it is about better living for people. And so I'll throw this question at you. Why is health important? Why is it important? Why is it important for you as an individual? Why do you think it's important for your family? Why is it important for your community? Why is it important for our society, for our nation? Why is it important? Is it important? Is it important?
Yes.
No. Yes. Okay. Should we exclude anybody from it? No. Okay. Well. Okay. We're jamming right along here. Very good. Okay. So why?
Well.
The what? Health is wealth. Absolutely. Very well said. By the way, many studies are conclusive on this. The healthier the population is, the more wealthy it becomes, or the better off economically people are, countries are, the healthier the population there is. Why? Why is that? Why does it translate, health actually translate to economic activity? Correct. Every person can contribute actually better. If somebody is well, their physically well, they're emotionally well, they're socially well, on and on and on. There's actually 8 dimensions to that wellness. Then yes, they can contribute better to the society. They can contribute better to their community. They can contribute better to their family, right? And support that. So it does translate into that. Why else? Why is the health important to an individual? Not just from the standpoint to contributing to something else or somebody else. Why is it important to that person? Live longer, right. Now, bless you, yes. The function better, feel better, right? Function better, live longer. Happiness, be happier. Be able to enjoy time with your family, with your kids, and all of this, right? Somebody asked me right before we started the broadcast, what area of nursing did I practice? And the vast majority of my bedside career and my managerial career in nursing, I spent in nephrology and dialysis, or in complex chronic care. And these are the folks that I took care of, my patients. They were chronically, terminally ill. Kidney failure cannot be reversed. It's a terminal condition. However, with proper care, with competent care, with confident care, and compassionate care, these folks can thrive, and still enjoy their families, and still enjoy their communities, and still work and contribute. And yes, so it is important, and that's why I love that particular aspect of it, because taking care of complex chronic disease and people that have that is it's like a puzzle. It's very complicated. And putting those puzzle pieces together and be able to stitch it into this wellness for a person, or at least facilitate their journey, wellness journey, is what gave me just utmost fulfillment, right? I'm pretty sure many of you came into this like, I want to do something for others. I want to contribute, right? Sure, Prada shoes are going to be in your future, with the current salaries and everything, especially on the RN side. But it's like, and those of you who are going for PNs, just one step, then the second step, and so forth, and it's all there, right? So, however, hopefully, right, it's not just the chase of a better living for yourself that you're in it for, right? They also are there to contribute to others and take care of others, and that's the crux of it. So it's basic physiologic needs, right? It's a requisite for healthy life. It's a requisite for productive life. Somebody realizing their full potential is predicated on whether or not they can be well, they can be healthy. So we've discussed pretty much everything on this list. Yes, health is extremely important to individuals, to families, to communities, to nations. Everybody with me so far? Okay, great. Now, how are we doing in the United States with health, Everybody giggles. And by the way, the slides will be sent to you afterwards to everybody, so you don't need to snap them and whatever. Just you'll get the whole presentation. So how are we doing outside of the giggles? Well, how are we doing in the States? Are we as healthy as we potentially can be as the population? Absolutely not. 50-50, perhaps, depending on how you, what data you're looking at. But, yes, there's some interesting stats that we're going to explore. Are we, does how healthy one is or well depend on where they come from currently? Absolutely yes. Yeah. It depends the community you grow up in. It depends where you come from. It depends where you work. It depends on where you live. It depends on very many different things. Now, so before we jump into the next thing, I want to ask you what is, just to put it out there, our health outcomes, right, so 50-50, that thing, our health outcomes as a population are not equitable, right? So they're not the same. It just depends, right? So what is equity? I know everybody, like, it has become a dirty word that somehow people are like, wow. It's like, it is not at all bad. Equity is a good word if anybody would understand what in the world it means. What does it mean? What does equity means? The what? Balance? I heard balance. Okay, maybe. But what is it? We all talk. Is it the same as equality? No. Equality is easier maybe to understand. What is equality? What does it mean to be equal? To be at the same level, right? So you know, like when Oprah back in the day, remember Oprah? And she's like, you get a car, and you get a car, and you get a car. And everybody gets a car in the audience. Fantastic. So that was like equality for the audience. Like everybody got a car. Oprah never asked whether everybody could drive it, right? Or it needed some special accommodation in order to be able to drive it, right? And it's just like, here you go, a car, and then roll on your way. So equality, yes. So what is equity in that? The what? Financial aspects? Yeah, I mean, there's all sorts of equity, but
Not being treated the same.
okay, so it's not being treated the same, true, but being treated how? And having access to what? Equity.
Can we say is the gain you enjoy after putting in some kind of work towards?
Maybe. Okay, it's the gain that you enjoy. Maybe. I'll give you the answer. Okay. Equity is when everyone has access to whatever resources they may need in order to be able to achieve the same outcome as somebody else. So in that car example and Oprah, right, although it may be the same car, right, somebody may be too small to reach the pedals. And then you need something for them to be able to actually press on gas if needed, right? So that's, everybody gets access to what they need to be able to drive that same distance, right? To be able to get to the same outcome. Obviously, there's a personal choice that gets involved in it as well. Because someone may have whatever it is they need, but they choose not to engage with that in order to get to a comparable outcome to anybody else. And that is fine. That is their choice, and that's an important thing for you as nurses to remember, is that people still do have a choice of whether to engage any kind of treatment, even if they have access to it or not, right? Or whatever care they may need. But equity is that. Everybody having access to what it is they need, resources, wise and otherwise, in order to achieve a comparable outcome to anybody else, to everybody else. So, and obviously you can imagine that what everybody needs is as individualized, as individual as every human being, right? Because we all, as universal as we are as beings, we all have different needs, and we're in different points in our lives, and on and on and on and on and on. So remember that. For those of you in cyberspace, by the way, use chat to chat among yourselves. We're monitoring the chat here. If you have any questions for me, or you want to contribute something that hasn't been said yet throughout, I'm going to pause every once in a while. I'm going to look in the camera, and I'm going to say, hey, is there something? And then I'm going to look at my lovely assistants here, and they will tell me whether there are any questions or any other comments that may be there that you'll have. Also, pay attention to the top of the chat, because every once in a while, a new question is going to pop up and be pinned to the top of the chat, and you have to answer it in order to count your attendance. See, smart. I'm like, here where I'm seeing you physically, right? That's like a resource for them is the pin thing in the chat, and then, if they're answering the questions, fantastic. Even if it's not correct, we know they're there, and at least trying to engage. Okay, so any questions so far? Anything so far that we need to, Mary or Brianne? All good? All right, fantastic. Do we have people in chat?
A lot.
Okay.
836.
How many?
836.
Wow, that's a big group. Yay, 800 and some. Popular, Probably not the right note, but hey. Anyway, so this is from and you probably can't see it really, really well, so I'm going to read it for you in the room. But this is from the Future of Nursing 2020-2030 report that was published by the National Academies of Medicine, and it's the second report that they've published. They published the first one a decade prior to that. This was published in 2021. Why was it called 2020 and then it was published in 2021? Anybody? Why was it delayed by a year in being published? COVID, yeah, of course, yes. So, okay, everybody with me? Everybody was alive and I'm assuming, yes. And aware that something was happening. Okay, all right. So this is what the report, kind of the punchlines of the report. Number one, we will never, we will never thrive as a country unless we all have what we need to live a healthy life, no matter who we are or where we live. Everybody with me? That's number one. Number two, nurses are catalysts for this change. They are trusted bridge builders who collaborate with people, communities, and organizations to promote good health and well-being no matter one's background. Very good. And then here is for the kicker. For our country to advance health equity for all, the systems that educate, pay, employ, and enable nurses need to permanently remove practice barriers, value their contribution, prepare them to understand and tackle the social factors that affect health, and now also I'll throw in environmental, and diversify the workforce. So that's the crux of it. Even before the National Academies published the first report, as I mentioned, I've been in education for about 20 years, started in 2005, and all of this became clear to me back then, right? It's that I had all sorts of questions when I was in practice and managing it, but then after arriving in education, I'm like, of course, that's what needs to change first and foremost in order for us to be able to drive any kind of better equitable outcome. So, okay, let's look at some things. 4.3 million RNs in the United States. This is according to HRSA. By the way, all of my slides, guess what they have? References, right, to actual evidence, not TikTok. Yeah, I mean, we'll love TikTok, but and you too could be a star, but maybe not today. For most of us, it's the song and dance that we do. So and then there's likely around 700 to 800,000 practical and vocational nurses in the United States. As a proportion of the population, we have more nurses than any other nation on earth. Already, we're short, but we already have more than anybody else in absolute and relative terms. So the question becomes, why aren't we doing great? Why aren't we the healthiest nation on earth and the most well nation on earth? That's I have my sort of hypothesis on that. But part of it, and going back to the profession, removing all of the other hats, is that we have become complacent as a profession, right? We show up at work, we clock in, clock out. We are the most trusted and have been and likely will remain. But it sort of ends at that, clock in, clock out. I have my patient assignment. I take care of those people the best I could. And then that's it. And I clock out and I go about my life. It likely is not going to work if we continue doing the same thing that we've been doing and expecting a different outcome, right? And so think about that as we go through this talk, what it is that you can do, you individually, not like us, the royal we, because as soon as the royal we shows up, nobody does nothing. We should do this. And then everybody goes back to sitting on their ass. Yay. Collectively, because we're waiting for somebody to start us, to march in front. So what it is that you are going to do differently, start doing, stop doing perhaps, after today, or as we go through this, starting now and until the end of your professional career. So that is a question for you, and think about that through as we go through these slides. The estimated, this is 2025. This data is projected in 2025, which is when? Now. McKinsey says we are at least 200,000 short today, at least. This is our ends. And as much as, or as many as 500,000 or almost 500,000 short as of today. Now, on the other side is the racial composition of the United States. So this denotes sort of the split 59-41, white population, non-Hispanic, and everybody else, 41%, that's nursing. 80%. See anything unequitable in this picture? Yeah, me too. Me too. Now, by the way, equity or diversification, it's not, so the National Academies of Medicine didn't just like, oh, and we need to diversify for diversity's sake. It is not at all that. Is what the studies continually show. Then when the healthcare workforce closely reflects culturally, economically, and demographically the population that it serves, the outcomes are better, and the care is more effective and more efficient, and therefore cheaper. We're going to talk a lot about money and how much we're dumping into the system currently. So this need to diversify the profession isn't just, it is good for everybody, and at the end of the day, it's going to be cheaper for everybody as well, if and when we can get there. And so yeah, by the way, this song and dance and building this company, founding it and building it from the ground up, from scratch, is my answer to it, right? This is what I said I will do, I could do, I'm going to do. I didn't grow up in this country. I came into this country as a refugee at the age of 19. And so, I didn't speak a word of English when I came. And yet, again, somehow, just gotten to, why? Because I'm passionate about it. I am. I'm passionate about these outcomes. I'm passionate about health. Always have been. I'll tell you more stories later if you want to stick around and hear how I came to that passion. But for now, just know that. Okay, so these are between, so starting, this is 2023, I think, to 2030 in 7 years. That projection of 1 million retirements in nursing. 1 million retirements over that period of time by 2030, which means the shortage will become even more pronounced. It is not going to become better unless we start not just enrolling, but graduating and getting licensed more and more and more people. Unfortunately, the barriers exist such barriers exist in regulation for nursing education, that proves itself to be fairly impossible. And so I can tell you more later about what we're doing to change that as well, both to diversify it and to produce more nurses in the United States. So this is staggering. This came out, like, this is a couple of years now that it's been published. This is 2022 and 2023 data. 50% of all newly licensed nurses leave employment, leave their first job within the first 2 years. 33% of all new licensees leave the profession within the first 2 years. They go and do something else. After all of the energy, after all of the time, after all of the money, whatever else that is needed to become a nurse, people leave. There are many reasons why that happens. Why do you think that happens? Burnout, absolutely, right? And unfortunately, most schools do not prepare folks for that. They don't even talk about that, how tough actually it is going to be until it becomes better, until we have more and more and more nurses out there. It is not about, like it's my employer's fault that we're so short. We're short across the country, right? And you can't like stretch the pie that is not growing. And so therefore, again, you're enrolled. It's your job to go through this and actually graduate, yeah, and then get licensed and get to that profession and know that, sometimes, and we will, things like becoming more resilient, if that's what you need, right, are kind of built in throughout. So nursing school, tough. It is tough for a reason. It is tough to build you up. And so you have that resiliency that is needed, not to throw your hands up in the air and it's like, that's it, I tried. Try not, as Yoda said. Do or do not. There's no try. So, okay, now to performance. So this is a study. It's called Mirror Mirror, and it comes out. It's been published for almost 20 years now. Every few years, 2-3 years, the Commonwealth Fund publishes a comparative study of the U.S. healthcare system and compares the U.S. healthcare system to our peers. So Western Europe, Canada, Australia, so forth. So industrialized, wealthy nations. And look, if you compare ourselves to our healthcare to some countries in Africa, for example, right? We're doing amazing. That's not the fair comparison group, right? So when we're doing great against this group comparatively, then we're doing amazing. We're amazing at spending. I'll show you that later, but not much else comparatively. So see how like this is everybody. See, everybody, us. It even says us. Yeah. Everybody versus us. This is how we're doing. This is how much we spend. See that big dot? Yeah. So that's us. Like everybody's kind of normally distributed over here. And we're outliers. And so we spend the most in absolute and relative terms. There's a figure later on, but the latest is $5.3 trillion on healthcare alone. So we'll get to that. So we spend the most and per capita as well, per every person that is counted in our census. And as you probably know, not everybody is counted in our census. And so anyway, so we spend the most. This is, again, everybody and healthcare as a percentage of the GDP, which is the gross domestic product. And you can think of the gross domestic product as the size of our entire economy. So everything that we produce in the economy, like school, for example, and milk, and whatever else, burgers, and cars, and on and on and on and on. All of it, healthcare amounts today to about 17.6% of that entire pie. More, I mean, it is staggering numbers of the spending in healthcare that we do. And it would be great if we were getting the outcomes that we need out of that spend, but we're not. We're not getting those outcomes. And yet again, we're spending the most in absolute and relative terms. It is projected that by 2033, it's going to be more than 20%, or it will go above 1/5 of our entire economy. 1/5. Think of all of the products, all of the services, or everything that happens in this economy. Yeah. And at the trajectory that we're going, that 1/5 of our economy or trillions and trillions and trillions of dollars will buy us worse and worse and worse outcomes. So that's something to ponder. This is where where the spend goes. I'll show you some breakdowns a little later. Again, we spend the most. We spend a lot on this is inpatient and outpatient care. This is sick care. Yeah, everybody with me? This little tiny boop is preventative. It's like, trying to promote health, prevent disease, and all of this. It's that thing. That boop is way larger everywhere else as compared to the entire spend. Right? So it should give you some ideas of why maybe and where we can go with this in order to get to better outcomes and why we're not necessarily getting where we're supposed to get. Again, performance compared to spending. This is on the this is the y-axis, yes. On the y-axis is health, higher health system performance toward that end, lower health system performance toward that end. Lower spend here, higher spend here. Winning. We're absolutely winning. We are. Spend the most, get the least for it. Congratulations. With 4.3 million RNs in the country. In addition to all of the other ancillary and medical professionals and so on and so forth. So a lot to be desired. We face the most barriers to care, to accessing care in this country. We trail all of our peers in the experience of in access and experience. This is interesting. So this is the cost-related access problems. So people cannot not being able to access care because of the cost of it. 50% of low-income population is reporting problems, 50%, half. So that 50-50 that you're talking about. But 27% of higher incomes population report access problems. 27%. This is where everybody else or below is for their low-income populations. So again, yeah, it's like, how we're doing in healthcare? No, do you want to do something about it? Yeah, me too, I'm doing it. You're going to do yours. And we're going to talk about, hopefully some ideas you're getting. It's percolating there while this data is flowing of what it is that you can do. Because I will ask all of you, what are you going to do? Every single one of you in this room will have to answer that question. And don't be like, well, it's what she said. Put your own flair on it, what she said. And then we'll go from there. Skipping care. Due to cost, again, consultation, first bar, actual medical treatment tests or follow-up, the light green, and then prescriptions at 23%. Skipping care due to cost, cannot afford. But a bright spot is there. We have figured something out. And we're one of the top performers in care delivery and coordination. So care delivery, not coordination, care delivery process, we're all right. So if somebody accesses care, then we're okay. They're like, we're doing all right. Now, as I said earlier, though, by the time somebody accesses care, in a lot of cases, it's too late, right? Because we don't go to the doctor until what? We're like falling apart. It's like, okay, I can't move any longer, I go now. Whereas, 5 years earlier, the outcome would have been much better. Yeah. So that's, again, and nursing has a lot to do with it. By the way, how many people are in the United States? Or, do you know? Count it. 350 or so million. Estimate, something like that, right? Almost 5 million nurse professionals between RNs and PNs. Doing the math in your head? Yeah. That's more than 1% of the US population. Close to almost 1.5%. That means that, how you have like 2,500 friends on Facebook? Yeah, okay. Only 100. You only need to take care of 100 of them. Yeah? And then it's like boom, 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 boom. Every 100 people have a licensed nurse. Less than 100 people, a licensed nurse for that particular group. If only we were, got off our butts, dusted it off, went into action in your community, right? Not asking you to take on the world. Just do what you can in your community. It will be great. Okay, fantastic. All right. How does it feel to know that statistically you and your loved ones will not live as long as everybody else in the countries with high income? Sad, exactly. Me too. I know, people beat the odds, but look, we're almost full 5 years on average behind the top performers here. New Zealand, Australia, Japan. Japan is not a part of this comparison, but very high as well. Spain, not a part of this comparison, but very high as well. Yeah, has a lot to do with, gotta go. All right. Do it. Run. I know. When bladder's cold. By the way, in some other nursing schools, they will tell you, hold it! Builds up your character. Nope, it doesn't. It just takes you one step closer to depends. Yep. So nope. You can't, this notion of take care of everybody else, forget about you, is an erroneous notion. Self-care is a must. Your wellness is a must in order for you to become most effective in your practice. When she comes back, tell her, or on break, it's like you did the right thing. Yeah? Okay. So live the shortest, have the most avoidable deaths. Avoidable deaths. We'll talk about a little bit more about those stats in a little more depth later. This is our life expectancy. See that dip for everybody? See how much we dipped? Some others dipped as well. Some others didn't in our comparison group, but that's COVID. That's all of the deaths related to the start of the pandemic before vaccines became available. As nurses, what do we think about vaccinations? Just, to throw it out there, the hot topic. What do we think about vaccinations as nurses? What should we think? What does the literature say we should think? They are effective at preventing disease. Oh my word. That's what we think. They are an effective method of preventing some horrible stuff. And have I mentioned expensive stuff is preventable by vaccines? So no matter what, whoever politician, whatever tells you, put on your nurse hat. Find the evidence that is science-based, not opinion-based, not popularity-based, not anything but science-based. Those things save lives. We're bounced back. Not quite all the way, but we bounced back because of the vaccine. Some herd immunity as well. But waiting for the herd immunity to go through, you know, it's a high price to pay. And doesn't contribute to our average life expectancy at all. So you pick. Yeah? Yeah. All right. Avoidable deaths, woof, per 100,000 of population. The top number is 2009. This is, you know, for everybody. 2019, we are at many compared to anybody else. And in that decade, most countries have reduced their avoidable deaths by a very significant number. We eked out, for all the spending that we do, 5% reduction. Not good. Yeah, cancer is leading everywhere, as a matter of fact, but everything else, accidental deaths, poisoning, overdoses, intentional self-harm. Did you know that, you know, for all of the stories that you hear about, you know, shootings, mass shootings, which are horrible, and because, you know, are guns affecting our health? Yeah. I mean, hello. I mean, just emotional stress maybe, right? But yeah, if somebody gets shot, guess what? Their health is affected, even if they don't die from it. Okay, but did you know that for all of the things that you hear on TV, that the most gun deaths occur through intentional self-harm? Because somebody can march into whatever, pick your favorite mart, and get one with no wait periods, with no whatever, walk outside and shoot themselves. And that's what most people do with those things. Does it affect health? Our average life expectancy? Yeah. All of that. Is it preventable? Yes. Yes. By many different means. Many different means. So ponder that. Ponder what you and your nursing practice can do for that. By the way, firearm deaths are the leading cause of death among youths from 1 to 19 years old. The leading cause of death in the United States. Youths 1 to 19, with Black and Hispanic males affected the most. Maternal mortality in this day and age. About 24 maternal deaths per 100,000 live births. We're outpacing everybody else by a huge margin. We're doing worse than the nations in, you know, in the stands like Kazakhstan, Turkmenistan, kind of like that Middle Asia area, which is poor and not great, and then they still are doing better. Black women die 3 times more than their white counterparts, either during pregnancy or childbirth or in the 1 year following childbirth. So 55, that number is 55 for Black women. So how are we doing? Equitable? No.
Is it preventable?
Oh, let me ask you, do you think maternal deaths are preventable? Yes. Absolutely yes. Prenatal care, you have to have access to it. You have to, have people that trust you. When you tell them something is wrong, I know my body, there was a very well publicized case of Serena Williams, who has gone through, she almost died during her childbirth, and kept saying to the care team, something is not right. I know my body really, really well. Something is not right. Do something, figure something out, whatever. And she, like, the only thing that literally saved her life is the fact that she's a huge celebrity, and she was like, I will sue the crap out of all of you if you don't do something. Now, good for Serena. Yeah. So, look. So do you think it's important that the healthcare workforce that takes care of the patient population actually reflects the backgrounds of that population? It is absolutely essential. Essential. I'll give you another one. The number two preventable cause of death in the United States is, we want to venture out and to what that is? Number two. Heart disease is first. The what? Nope. Not so that's hypertension is in a kind of heart disease category. It is colon cancer. 100% preventable. Absolutely preventable. What do you have to do? After a certain age, you have to screen for it, have a colonoscopy perhaps, right? If you have high risk background, yeah. Do you know? Do you want to venture out and guess which population dies the most from colon cancer as compared to anybody else? So, which demographic population dies the most from colon cancer proportionately than anybody else? Who? Black men. Black men. Why? Well, maybe they can't afford it, but they don't go. What happens the most with black males? They don't trust the system. They don't trust, and you ain't putting that thing around my you-know-what. And who is absolutely almost not present in nursing? Black man. Thank you for being here. Make sure you graduate and get out there and prevent some cancer. I'm telling you. So income background makes a huge difference, right? If we're consistently having higher income populations enter the profession, they have no idea. No matter what they look like, if they don't come from that community, meaning that level of income, it is still very difficult to become very, very, oops. What happened? Did I do that? Okay. All right, okay. Yeah, I was just I lost all my prompts. Did I trip over something? You think? No? Maybe? Oh. It went to sleep. Wakey, wakey. It says no signal. Interesting. Don't know. Let's try that again. Oops. No signal. Okay, well, we'll continue sort of on a cool. All right. Well, technical difficulties, can't quiet technology. It's just, one day we'll figure it out. AI will figure it out for us. Yeah, AI is going to be like, I know how to fix your projector. All right. Okay. Awesome. Boom, 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 boom. We're here. Okay. So this is the prevalence, again, comparative, prevalence of multiple chronic conditions in a U.S. population. Almost 30% have more than one chronic condition. Close to 50% have at least one. Speaking of 50-50, wow, is a lot. Most of which are what? Preventable. Completely preventable. So, yeah, winning, wrong direction. Obesity. This is a little outdated. The US number is 42 right now, 42%. Maryland, actually, I looked it up. It's at 42.7, so kind of right around the average. It ranges anywhere from 33. That's in the lowest. That's in the actually in the District of Columbia, and to 51 in West Virginia. Yes.
Where exactly are you getting these numbers from? Don't worry.
Actually, no. Science, they get these numbers from research. The whole world does not, but it feels like it. But why? Okay, and not to go with like, so and 42% severely overweight, right? So like, yeah, I mean, you can call it obese, severely overweight, like 42%. Why is that? And it is not about body image or beauty or anything like that. Why is that important? Why is that number has to be driven down and has to come down? Why? Health issues, other health issues that are associated with obesity. What are they? Hypertension, so heart disease, diabetes. The what? What else? What else? Hypertension, diabetes? True, contributes to heart disease. What else? Heart disease, we're still there. Yeah. Arthritis, so osteo issues, right? Bone skeletal issues, things like that. And the list goes on and on of that. So there is a connection between things, right? So again, not at all saying that somehow it is, shameful or anything like that, right? It's just awareness, and what, as nurses, what do we do? That's the question. What do we do to help the population that we care for? What do we do to help that population navigate the thing, right? Why? Well, let's spend just a couple of minutes on why do you think this is so? What leads to it? Our lifestyle. What particular two things? Food. Yeah. Everything that is cheap and delicious. Like, I mean, you put some lard, some salt, and sugar into it, mix it up. Your taste buds are going like, so good. It is. It is absolutely so yeah. It is. I mean, we're not gonna call out the, but we know where it's available and which aisles in the store that we gravitate to. Oh, look at the pretty package. Oh, baby, do you want some Wheaties? They're made out of wheat and a lot of sugar. Because wheat alone, that's like, horses love it, I hear, or whatever. But, we're like, nah, not really good. Why? Why are we so attracted, human beings? And this is like to physiology. Why are we so attracted to fat, sugar, and salt. The what? It tastes good, but why does it taste good? Like, why do horses like, nah, you know, grass is good or whatever, and we're like, nah, not so much. Okay, because it's sort of like when you study evolutionary biology, right? It'll tell you that how this particular trait has evolved is because for hundreds of thousands of years we didn't have enough, right? There was no agriculture, there was nothing to produce, so we were foraging, kind of foraging through the woods, whatever, and everything that obviously sweet, berries, whatever gave you like a boost of energy. Finding something that is fatty, catching a squirrel, for example. Oh my word, that was like feast. And on and on and on. So we're biologically developed to be attracted to those things. It doesn't serve us anymore because it is available. Food is really, I mean, a lot of population is malnourished, and a lot of population doesn't have access to nutritious food, but cheap stuff that is not great for us is available. And that's what we eat, and then combined with the other part of the lifestyle, which is, you know the thing. Oh, I watch my mother-in-law. She's 89. She was visiting, like, for a week. This is the most what I saw her do, day in, day out. She just sat there, swiping. You know, the endless, the scroll of doom. Everybody with me? Yeah, And everybody, yeah, we're like, this is our favorite activity. Yeah? It's like, oh yeah. And your brain is like, every time the new thing comes up, guess what? Evolutionary as well. The biology, the neurotransmitters in your brain go like, bing! And it's like a injection of dopamine and like neurotransmitters. That feels so good. Drugs act in the same way. Absolutely the same way. So like Coke, TikTok. Kind of similar route of action. Yeah, So it's just like, no, can't be. I'm like, yeah, might as well, take up Coke. But that's like frowned upon, right? Yeah. TikTok is not. Should be, but it's not. The government in Utah, actually, like you likely guys know that we're based in Utah, has passed a law that bans electronic devices and TikTok and the like and then all sorts of rules for TikTok and Insta and all of that that surrounds youth and the brain development. It is very damaging to our youth, very damaging to their brain's development, very damaging to, and then the sort of emotional wellness that is like very, very difficult to find in a young population. The prevalence of anxiety and depression is staggering in a young populations, and not just here, around the world, right? And so it's and then the MART is available if you need an exit quickly. So, okay, oof, whoa, Mikhail, you're such a joy kill, Mikhail, yeah? But this is important to understand. This is important for you to keep your eye on constantly. And remember, if you would like any change to be, you have to be steeped in this, and then you have to do something about it. So we're ranked the worst in mortality amenable to medical care, in infant mortality, in life expectancy, in suicide rate, obesity rate, prevalence of chronic conditions, cost-related healthcare access problems, healthcare system efficiency, healthcare system equity. $4.9 trillion in 2023. It is projected at 5.3. The final data is not out yet. It's going to come out probably next month. Maybe. I don't know, with the government shutdown, it may never come out. So this may be all I ever get. But, you know, it's good enough for me. The early estimates, $5.3 trillion in 2024. $5.3 trillion. Those of you with paper in front of you, like, start drawing some zeros. Yeah? So like 530, just like 530. Yeah? Oh, everybody good. $530, you know, you kind of get it. Yeah, that's like a good down payment on an iPhone, whatever. I don't know, like, yeah? Okay, so like we kind of relate to that. Like, you add a zero, that turns it into what? 5,300. Ooh, yeah, that's nice, huh? That would be a good real bonus, and like around Christmas, oh, that would be amazing. Then 53,000. Some of you don't make that in a year. Partially, that's why you're here. Okay. And then that turns, you add another zero to 530,000. Yeah. Okay. At twice that, you're like, ooh, that's a good retirement number for me. Sounds really, really good. If I ever get to $1 million, that would be so amazing. Yeah. So that's, you know, and then from 5.3 million, you know, which is more than your million by 5 or so, you add another zero, that's 530. You add another zero, and that's 5.3 billion. Yeah? Now, how many zeros do you add from there? 3 to get to $5.3 trillion. Staggering. Staggering. And again, it would be worth it to me, maybe to everybody else, if we actually got good stuff for it. We don't. And that's unfortunate. So this is the split of the who pays for healthcare in the United States. Medicare. What's Medicare? Old folks insurance that is government provided and we all pay for. Yeah? Everybody good? Okay. If you work, like it comes out of your paycheck, you're constantly contributing into it. Okay, so that's Medicare. 1.03 trillion, 21% of total, more than 13,500 per person enrolled in that system. So that's Medicaid. It's state for people of low income, people with some chronic conditions. By the way, people on who have been with, and this is the latest, I remember to be correct, but it may not be correct anymore. But folks who have been with chronic kidney failure, kidney disease, after 3 years, they no matter what age they are, they qualify. And there's some other really high stakes chronic conditions that people qualify for Medicare after a while. So Medicaid, state-based programs that support lower income populations. Who pays? Everybody who works. Private insurance, 1.5 combined, all of them. Notice the difference in spend per enrollee. Less than half of what Medicare spends annually. Now, we'll talk about that in a sec. And then out of pocket, another $500 billion. So oh, I don't have per enrollee there. Oh, because it's not enrollment. So who pays? Who pays for healthcare in this country? 75% people who use it and the taxpayers. 75% of it. We already pay the most of the entire system as taxpayers. And yet, we still argue around how it should be structured. Imagine a car insurance. Car insurance like Medicare, sort of the like. I am going to enroll only those people who will for sure get into an accident this year. That would be a crazy insurance model, wouldn't it? Yeah, because how does normal insurance work? You enroll a little bit of, those who are high risk, a lot of those who are lower risk, and then you cross your fingers and to make sure that statistically, it all is going to work out. Yeah? Okay. So we created a system to where we enroll everybody who is high risk into the same pool. And then we scratch our heads and we wonder, well, how? Why is it so expensive? And why don't we get any kind of whatever? So yeah, it's kind of like that. What is the difference between our system and all of the other healthcare systems that comparatively I was showing you? What is the biggest difference between healthcare systems that of Western Europe, Canada, Australia, UK, and ours?
I would suggest maybe the government pays more of it.
Not necessarily the government, because who is the government? We the people. I mean, we don't do it well as we the people because we just show up at the ballot box, maybe. Oh, on a good, like a good person, a good voter would be there, every 2 years at the ballot box, maybe every year, even like local initiatives and whatever. And then it was like, that's it, my job is done. I'm going about my business. And then why is it not working? Why is nothing working? Because we are complacent. We sit on our butts all the time, not just nurses, but as citizens, and so on and so forth. Okay, but back into what was the question? Oh, I lost.
Why our peer countries are
Oh, right. So what's the biggest difference between our systems? What do they have that we don't? Not necessarily that the government pays more. Different structure. That structure, the what? Better health. Well, what? Accessible, yeah, but from the payment standpoint. Everybody else has universal coverage, meaning everybody pays into the system and everybody can use it, right? The system, some of them are completely government run, not suggesting that. This will never work here. But some other countries on that list are not government-run systems. The payor is the government that collects taxes from everybody and it pays, but then everybody is in the same risk pool. Everybody, right? So when Affordable Care Act came out and was like, we told young people, hey, you got to buy insurance. And they're like, no, forget about it. I'm young and healthy and all of that. And it's like, why would I do that? Why should they do it? Because newsflash, if you're lucky, you will get old and need care. And then imagine everybody else, it's like in the system, all the young folks going like, yeah, forget you. Shouldn't have gotten that old. This is our attitude today. Like, screw you, who cares? I'm well. You're welcome. Yeah. So our issues, right, they go so much deeper. That's like superficial stuff that you see or being discussed and whatnot. These systems are very complex. But the way why it works and why other countries do get better is because they're universally, everybody can access it. And it's universally available. And as you have seen, on average, it is cheaper for everybody. We still pay the most. We already pay it. Why don't we use this money that we pay more wisely into the system? Okay, so that. You'll look at this later. This is our spending compared to everybody else's. Sponsorship of healthcare, we've talked about that. Anywhere you see government, that's you. Right? Because government, you know, where does it get its money? Either borrows it from China or other places, yeah, or taxes us. Yeah, those are the two big sources. And this is where the dollars go. Hospital care, $1.5 trillion. And what do we treat in hospitals? Conditions that are the most acute, most of which could have been prevented. That's our system. It's a reactive system. It's designed reactively. It was designed in the 1950s, and the biggest problem in the 1950s was what? What was the biggest healthcare problem in the 1950s? Right after the World War II. Babies. Babies were the biggest issue. People having many, many babies. There was a war. Nobody had babies, really. And then the war ended, and everybody was like, woo! So we had to build a system that supported it. Yes. And yeah, now what we treat in that system is the most, is acute exacerbations of chronic conditions. Not good and very expensive. Very, very, very expensive. And you'll see the rest of it. And finally, before we go on break, waste estimates in the healthcare system. This is from 2019. According to these estimates, as much as $1.2 trillion were wasted in 2023. Failure of care delivery, failure of care coordination that other systems do not have because everybody has standard records and it goes with you wherever you go. Doesn't matter. Over-treatment, you know. We see her twirling in the heels on TV commercial. And she's like, oh, and oh, and oh. And you're like, oh, that pill is going to make me feel amazing. Give me the pill, doctor. And then the 15 seconds that they have with you, they're like, oh, just here, just go away. Right? So that pricing failure, you know how on Amazon you shop and shop and shop, and whoever, like if somebody sells the same thing for like 7 cents less, you will click on that one? Yeah. How many of you do that with healthcare? No one. Well, it's $25 one way or the other, although for exactly the same thing. One facility may charge $500, one can charge $5,000. All the same to you, not the same to the system. We're absolutely uneducated as consumers, so we'll talk about that and what you can do. Fraud and abuse, administrative complexity, it's myriad of different providers coordinating with myriad of different payors. That's costing $300 billion almost a year, more than in today's money. So yeah, that's that. And on that happy note, I will send you on a break, and we'll take about 11 minutes, start trickling in after that. So at the top of the hour, and we'll get going a few minutes after that. Thank you, and we'll continue after the break. All right. Well, welcome back, everybody, or almost everybody. Some are MIA. Hopefully, you're trickling in over there in the cyberspace. I'm going to take the next few minutes to ask you for kind of your thoughts, comments, questions. Same out there. If you have any questions, pop them in the chat, and then my trusty assistants there will read them to me. So yeah, thoughts, comments, questions, anything so far that stands out? Yes.
One thing I didn't see on there was like overdose deaths.
Overdose. Yeah. So it was mentioned just a little bit. There was a chart somewhere. Accidental poisoning and overdose. So it's that one. And then that's the intentional self-harm is the last one. So yeah, it is the issue of drug abuse or drug substance use disorder. Let me use the right names. Is prevalent and again affecting quite a bit of the population and things. We'll have to do things about it. I'm going to ask you what later. Other questions, comments?
Yes, sir.
Yes.
I know you said the difference between our systems and that of our peer countries is everybody contributes into it and
Correct.
processes it, and it is cheaper for everybody. So does that mean that there is no demarcation between the rich and the poor when it comes to
People contribute. Everybody does contribute. If you're making any income, you do contribute, but it certainly is proportional to the. So the question is whether there is any difference between how much people pay into the system. Absolutely yes. There is a difference. You pay proportionately more the higher your income is. Yeah, into it according to your income. But then hey, like if your income is higher, right? Like I don't think you'd be complaining. Or maybe you would be, but like again, if part of the issue that we collectively experience, right? We talk about nursing as that compassion is a must, right? Caring for others is a must, but we have lost that ability as a society, right? We're losing that ability as human beings to relate to each other and be compassionate to each other and see each other as a human being first that feels pain the same, right? And experiences joy the same. And like getting back to that, I mean, social media has a lot to do with it. Social isolation has a lot to do with it, of how progressively worse and worse and worse we're becoming. But I, like if there would be a silver bullet for any of it, it would be nice. But there's not, right? Like it's every single one of us starting to make different choices, right? And I often say this to everybody who starts working. I meet absolutely all of the collaborators that start working at Nightingale. To this day, every single one of them, I spent about 4 hours doing an orientation, my part of the orientation with them after they've been here for a few weeks. And I extend the invitation to all of them to be, right? And look, I'm not the first one to extend that invitation, but be what it is that you want to see in the world, right? Not just talk about it, not just sort of scream about it, not just whatever. Everybody should be kinder. I mean, start with you, right? If you want the world to be kinder, be kinder. I mean, that's a requirement. If you want the world to be more compassionate, be more compassionate. If You want the world to be more forgiving? Be more forgiving. Trust, on and on and on, right? It goes on and on and on, but it's an individual choice. We can make that choice. Whether we do or not, that's like nobody but you can control. The only entity in your control is you. The anger that you sometimes experience, it is triggered by something, by somebody, by whatever it may be. But it is yours to either harbor and carry forward or let go. That's what you have control over, right? And so you will never be able to control anything outside of you, even like those, some of you have kids, I'm sure, and you think you're in control of them. No, you're not. As soon as that entity recognizes their independence of you and from the environment and that there's something different, you've lost control. Now you can guide, facilitate, sort of encourage, invite, do all of those things, right? Influence, but not control. And so that's and again, and we're waiting. I think the bottom line of this issue is that we're waiting for somebody else to do it before we're willing to, right? Rather than jumping into something ourselves and saying, hey, it's my job, like I have to do it. And then maybe others will follow suit and do it. And even if they don't, that's still, your choice is yours. So that's an important piece to remember, right? So back to this like proportionate payment, and the richer you are, the more you pay. I mean, I think it's fair, and many people do who are well off find it fair. And so it's, yeah. Okay, there is a question. Yes.
Okay, so going back to the nursing shortage, why is it difficult for graduated RNs to get employment even months after graduated?
Okay, so graduating RNs, difficult to get employment after months after graduation. One of the answers is, like, first of all, I don't know where you are. If you live in a sort of area that is saturated with nursing schools, right? So nobody in a rural community ever had that issue. Like, I can just tell you that, right? Because the jobs are there, jobs are available. Some areas, because of how we've designed nursing education systems, are proliferated with nursing schools. And then everybody competes, then everybody who graduates competes for the same jobs, and obviously we don't want to drive too far, we don't want to work nights. Oh, long-term care, meh, forget about it. So not sexy, nobody's ever made a TV show about long-term care. So like, I was like, why would I commit to complex chronic or anything like that? So it is, again, like part of it likely is a product of where you live, and part of it is the product of the choices that you make and the positions that you're looking for and willing to take. And out of nursing school, directly out of nursing school, unless you already have tons of experience somehow connected to an institution, trust me, nobody's going to hire you in NICU. So like that's a step, a couple of steps after, right, if you still want to pursue that. But starting your career in, where do we actually need nurses? Nah, ER, good, acute, like keep acute care out of it. We need people in long-term care. We need people in health promotion, prevention of diseases, management of chronic conditions. Haven't we been talking about all of these things all along, and what ails this nation is and when everybody decides that no, the only path for me is acute care, we're not going to get out of it. We're just not going to get out of it, because we have to shift. We have to shift our perspective. We have to shift our paradigms into something that will be more effective and prevent things from happening in the first place. When I did a good job and my colleagues did a good job with our patients, they would never end up in a hospital. I mean, obviously their choice still matters in there, and if they followed advice, right? If they sort of, but that's where it is. And again, look, I mean, like I blame it on TV. Did I tell you in the beginning? Throw it away. The Good Hopes and, the Grey's Anatomies and like whatever else. That's not real world, really. It's, it's entertainment. And everything is resolved within 45 minutes. Or an episode of Arc of 3 by 45. No. So that's, I mean, I think again, it's changing, shifting perspective, and being willing to, dedicate your life to something that is, actual care and compassion and all of that, and the taking care of the population we've talked about, community. Nobody, I mean, again, if there was sexy TV shows about, community nursing and all of that, I mean, like everybody was like, yeah, take me there. But there's not. Hollywood, that doesn't, it doesn't pay as much to begin with, and certainly it is not lucrative to make a show about. It would be very boring, and yet so needed. So, anyway, any other questions? Yes.
Okay, how do we see the role of nurses evolving to meet the needs of the public?
Oh, that's a very good question that I throw back at all of you. And we're going to, and hopefully we'll generate a lot of ideas. This is the next part of the exercise that we're going into. Just that, what is that future of nursing and your role, right, as a both a nursing learner, a student, to begin with, and then as you enter your practice, as you progress in your practice, as you gain more skills and knowledge, we'll talk so kind of keep both hats on. A learner hat, what it is you're to do immediately now, what can be done, and in order to set yourself up for then better practice effectiveness, and then what, systemically perhaps, again, as an individual, changing a system as an individual is not, it's tough. It's not sort of easily available to us. I'll give you one example. I'll give you my example a little later of sort of driving systemic change, and actually, and now I know 20 years into it that it will happen, but 20 years. Spending 20 years and doing a lot of things for it. I'll keep you in suspense for a little bit. Good question. So back at you. That's a question for everybody. Other questions?
What can be done to reduce burnout in the USA?
What can be done to reduce burnout? Yeah, we have to enroll, graduate, and license way more nurses than what the system allows us to do today. So Nightingale is partially an answer to that, but again, we can't possibly, all of a sudden it's like, yep, solved the nursing shortage. We're doing our part, but everybody has to start doing that, right? And if you start looking upstream, another thing, so maybe one of the things that you can carry out of today is this. All of the outcomes that we ever experience, and I, as human beings, as individuals, as families, as kind of community, society, all of these outcomes that we experience, they're not by accident. There's very few things that are truly accidental. Everything else is by design of the system that is producing it, right? So, and I this. We knew this from the industrial kind of settings for a very long time. 1950s, Dr. Deming, he said, every system is perfectly designed to give you exactly the outcome that you're getting. And unless you can start making changes all the way upstream in that system and ask, okay, well, if this is happening here, if we're experiencing this outcome sort of like downstream, what's right above it that drives it, right? And then you ask, but why is that? And then you go further. And then why is that and why is that? I don't remember the name of it, but there is a technique that came from Japan where you ask five whys, it's called. You ask the question why 5 times about something. So if this outcome is this, why is that? And your first answer, okay, fine, but why is that? And that's only the second one. And then why is that, and why is that, and why is that, and why is that? Then you arrive enough upstream to change something in that in order to be able to drive a better outcome downstream. So my answer to that question, reducing the burnout, producing more nurses, and all of that, yes, educational system has to change. But what must change in order for the educational system to change is the regulations that create all sorts of barriers for production of diverse nursing workforce in the United States. And every state, almost every state, has that on their books. And it is controlled, that regulation is controlled by a handful of people. And that is unacceptable. And so again, in order to drive that, yeah, and I'll give you again my example later, just one of them, but that has to change. That has to change in order to drive more nurses into the profession and get more nurses into the profession, more diverse nurses into the profession, and for us to have enough and the burnout to go down and all of those things. So that's that. Other?
How can we improve the rate of black male nurses?
Oh, how can we improve the rate of black male? That's a great question. If I had the answer, I would be. I actually do. I have the answer. What's needed is educating boys. Going and getting them interested when they are somewhere between 6th and 8th grade. And this is based on evidence, based on literature. This is where when kids are impressionable, they're searching for kind of meaning and showing them, for boys specifically, because they're like, oh, that's a girl's thing to do, you know. And you can show them how heroic the profession is, and you can show them all sorts of different things that nurses can do in their practice and get engaged in their practice, and sort of like the heroism and the outcomes of it. If we can bring the health of the communities up, right? You can connect it to their family, and like there's all sorts of things. We are doing that through Nightingale Foundation, which actually has held, this is a new foundation, we created it two years ago, which held in a couple of parts of the country what we call spark camps for like middle schoolers and high schoolers, to where, yeah, like we went in and set up shop and showed them for a day what it is like, and brought, you know, cool stuff like Oculus goggles into it. And guess what? People are like, yeah, rock and roll. Let's do this. I want this. So that's I think, I mean, you have to start really, really way earlier. By the time people are in 9th or 10th grade, it's too late. Maybe okay, but definitely by the time you get 11th, 12th, is like the mind is made up. And so you have to go further down the stream. And who's going to do it? Who's going to get, do you think Nightingale Foundation, and 3 staff members that it has, can get to like enough black boys? Absolutely not. Whose job is it? Exactly. And not we. My job. I can do something about it. I can go and partner with my local school, middle school, and say, hey, let me show you some cool stuff. Yeah, like that's like, again, the design is, and that is so much more upstream when kids are impressionable and trying to make up their mind about things, right? And you can get more. Go ahead.
Yeah, I have a question. You posted something about the waste of funding.
Yes,
and
the waste in the system.
Yeah,
Yeah.
so is there anything put in place that can prevent those things from happening.
Right. And again, there is like the answers are there. Things can be done to prevent waste, right? Administrative capacity, administrative waste, spend close to 300 billion or probably 300 billion dollars now. You know how we duke it out all the time in the Congress? They're like, oh, 10 billion, here and there, whatever. Like this stuff, I mean, it's like in trillions, and we can't get anywhere to any kind of agreement. So the other countries solve it through having a universal single payor system where there's only one payor, and that's that. And it's administered in some countries. It's administered by the government itself. In some other countries, it's administered through a third-party administrator, but it still is one payor. So way less coordination, 300 billion saved. But yeah, like if I was to go and like walk out and just go on some news channel and say that, oh, they'll be throwing like potatoes at me. Or tomatoes, or whatever else. Because, like, oh, how dare you suggest better something. Anyway, yes?
So I had a question to go back on the last one that you were on. So you said that we have a lot of nurses that go through school but don't.
Correct.
Why
Correct.
is that?
Because, people are not prepared, right? Because what do you think education is all about? Yeah, but like at the end of the day, money, yeah, okay, but like while you going through school, what's important? Focus is important, but what are you after? Oh, if you're after knowledge, that's fantastic. If you're after knowledge and skills and competencies, good for you. If you're after grades, nope, because you'll find a way to get a grade without obtaining competency, without obtaining the knowledge that is needed in order for you to be effective in your practice. So, I mean, it is, and literally the entire nursing education system, and we're moving away from that because I've, have known this for a very long time, is set up to produce good test takers. But it's not set up to really produce competent nurses. Somebody who can think on their feet, in the moment, in a situation, and reason and make the right decision because they have been, so the simulations that you get, right, like the Oculus goggles that you get I don't know if we're implemented that yet in a PN space, but in the BSN it's been there for a while. In the ASN is that you get, the only way to learn is to get simulated and simulated and simulated in something and then become good at it, right? Like develop your neural pathways that need to be developed for your reasoning to be developed. So, and that's why people, like especially people who are just starting in the profession, they're burnt out so fast because they're like, well, this was not on the test. Or where's my multiple choices? There is never a multiple choice in your practice. It is you and your patient. So when you decide to cut a corner at some point, as inevitably that thought will pop up, it's like, oh, I just want one more scroll, one more scroll, one more scroll. Yeah. Rather than actually working on it and studying and developing your reasoning and developing your competencies and all of that, think again. Think again. It is not about the grade. It is not about passing a test. It's about becoming competent. And that competence, when you're actually competent, it drives confidence in you. And then resiliency builds and you stay. But when you are unsure anymore, that's why people leave. I've spent all this time, I've spent all this money, and yet I think I'll be killing people constantly because I'm not. And there is not enough, right? So that reality is important to understand as well, is that the job is really, really tough. Really, really tough. That's why we try talking you out of it, as much as we can. Counteract Grey's Anatomy and stuff. All right, one more, and then if there's anything, and then I'll continue.
Yes,
Anything
ready?
else?
Yeah. So I recently came across a graphic on federal website regarding Medicare/Medicaid, stating that by 2030, I believe, our funding will run out. What are your thoughts on this?
Remember that thing about insuring all the sickest and oldest people in one pool? Yeah, it will. There's not enough, the misbalance, right? Although Generation Z, is larger in numbers than the baby boomers. Baby boomers was the largest generation. You know, that baby boom after the war, that the healthcare, we talked about it. They were the largest until now, until Zers. But Zers are just starting to enter the workplace. And baby boomers are retiring in droves and need more and more care and becoming Medicare age and all of this. I mean, in droves, daily. I mean, millions, right? So, and that misbalance between like having enough people in the workplace that are younger to pay taxes into it is like, it's gonna exist for a while. And when it's costing us the most to treat those people that are on Medicare, again, you see how, from the insurance standpoint, that system just does not make any sense, and not much will fix it. But everybody, everybody required to be paying into it in a way, proportionate with your income, whatever, but in a more kind of salient way. There's not a simple fix to it. And yes, it will, at the rate it is going and the amount of money it is spending and the amount of money that's coming in, it will run out. Do better, prevent diseases. Make care cheaper. Go into your community and actually engage with your community. So, like, preventing of diseases, promoting of health, and effective chronic diseases management. That should be on all of your minds and as all of the paths that you go. Those three things. We will not make the care any cheaper until those things work. And then we will not make sense of the insurance system until we have a system that actually works. Again, it's been proven time and time again that our system doesn't work, and yet we keep holding on to it for dear life. Doing the same thing and expecting a different outcome is a definition of insanity. Not my thing. Who said it? Einstein? So yeah, it was like, if you want a different outcome, you got to change something in the system design. Thank you, V. Yeah, okay, good. Okay, so on that note, so we've gone through that. This is the last slide that I have, but while you look at the slide, I'm going to read you some interesting statistics around this. And then you're going to start telling me on pick any point in this thing. So we have social, economic, and environmental factors, systemic inequities, generational poverty, social isolation and loneliness, climate change, gun violence, population behaviors and lifestyles. We've already talked about some of it. Inadequate health promotion, poor nutrition, lack of exercise, preventable and poorly managed chronic conditions, reactive rather than proactive, fragmented healthcare system. Disengaged payors, employers are clueless. They keep paying more and more and more and more. That's we as taxpayers kept paying more and more and more and more, and yet get not a better outcome for it. And then inability to access care. And there's tons of other things that could be there. So that's that. I'll give you a couple of statistics on from that page. Oops. Let me see. Where is it? Oi. It got away from me here. So as I mentioned, firearms play a central role in death among youth aged 1 to 19 years old and accounted for nearly half of the increase in all-case mortality in 2020. There's other statistics like that. We talked about the maternal deaths, inequity there, and how inequitable it is in the states compared to anybody else. Obesity, we talked about that. Lacking connection, so this is social isolation. Lacking connection can increase the risk of premature death to levels comparable to smoking daily. Living in isolation reduces our chance of survival, and social isolation increases the risk for premature mortality by 29%. Poor social relationships, social isolation, and loneliness can increase your risk of heart disease by 29%, risk of stroke by 32%. Smaller social network is associated with an increased risk of type 2 diabetes and other diabetic complications, including heart attacks and kidney disease. Among older adults, chronic loneliness, social isolation can increase the risk of developing dementia by 50%. Being more socially connected can improve stress responses, minimize the negative health effects of stress. Social isolation, or even the perception of isolation, can increase inflammation in the body to the same degree as physical inactivity. Loneliness and poor social support have been found to significantly contribute to the development and severity of illnesses after exposure to viruses. So there's that. An estimated 110,000 overdose deaths, for those who were wondering, happened in 2022, 2% increase from 2021, and from 2020 to 2021, that increase was 30%. It is going, the latest data that I've seen, that is tapering off. The increase is kind of flattening out, but still not great. And last year, which would be 2023 for this data, most overdose deaths continue to be linked to fentanyl and other synthetic opioids, about 75,000 more, or 4% from the year earlier. So cocaine and meth as well. So those are the stats. This is the factors affecting high spending. Pay per service versus performance, right? What does that mean? We pay for treatments rather than the outcomes of the treatments. Yeah? Everybody with me? Remember that twirling in the hills? I think if you're going to take, it's like, X, body spray. Same idea. Just spray it into your armpit and she will appear, because you'll smell so good. And that's all she cares about. Yeah, not going to happen. So overprescribing, doctors don't have any time, and that's why that happens. Unnecessary diagnostics, because again, we don't have comparative shopping, right? And we're if something, throw something, maybe it sticks. Lack of care coordination among providers. We're a very litigious society, so lawsuits cost a lot. Administrative costs, we've talked about that. No health promotion, disease prevention, effective chronic diseases management, provider shortages, clinician shortages, and consumers non-comparative shopping for services. We're overly optimistic. Those scary pictures in some states on cigarettes and whatever. And we're like, nah, not gonna happen to me. Yeah. And it's and those of you who, maybe none of you do it, then that's fantastic. But you've seen some of the, Game of Thrones, dragon kind of things on the street, where it's it's the new thing, the vaping thing, and that. Peach. I just wonder what that peach is doing to your insides. All right, and okay, it's oh, but not me. It's all it is a peach, really, for me. Everybody else is going to suffer. Lack of effective health education and sedentary lifestyles. All right, now your turn. Out of these two lists, and everything that we talked about, what it is that can you do? let's start with now, like immediately. What can you do? And you out there too, throw some things in. What can you do to start getting us into a better state of outcomes in healthcare and maybe cheaper care and all of that, more effective care? Yes?
Support the health system.
Support the health system. Tell me more.
Like, like trying to help prevent illness.
But how? You, like you, what are you going to do? That's the question.
Oh, educating other people.
Educating other people, very good. So, like, and in order to educate other people, first you have to do what? Yeah, you have to learn. You have to know your stuff. You know, sometimes I hear this from learners. It's like, well, they're not teaching me anything. I like have to do it all, you know, and like read and then whatever, and they're not telling me anything. No, that's the point. We give you the resources. We tell you how to navigate them. You gotta actually do it. I wish I was Oprah. I was like, you get a license, and like everybody gets a license. I'm not. Haven't invented that yet. I wish I was in all of your heads and like, you know, oh, that would be scary, huh? Right. But you have to, in order to make any difference at all, from now until the rest of your career, you have to constantly learn. And learn from the sources that are reliable and vetted and all of this. Not TikTok, not the internet at all, not Google. Anyway, so that, yeah. And then start parting that knowledge both through kind of, I think, personal modeling of certain behaviors, right? Because, I mean, if you reek of smoke, for example, and you're in front of the asthmatic patient who smokes, and you tell them, don't, they're like, meh. She obviously knows better, and it's okay for her, but you know, it's good. It's like, don't do it. Don't do what mommy does. No, no, no. Bad mommy. That child will smoke. I promise you that. So again, this you got to walk through that door first, and then you can, when you model it, then you can become an effective educator with the community. Yeah. So and that's, but you have to know your stuff. You can't just show up. You know, it's like just because I say so kind of thing. So okay, what else? What else? Let's get this going. I mean, everybody will have to go. So, like, better start raising hands. Or okay, yeah.
So when you talked about overdoses
Yeah.
and such, so I live in Harford County, which is 30 minutes. But I don't know if it's still the same, but back years ago, with insurance and treatment, they would want you to fail an outpatient to get coverage for an inpatient,
Yeah.
stuff like that. But I don't know what I do about that. But Narcan is free at the health department.
Right.
You can get that. You can go around in
Yeah.
the community.
So
and it's free to be educated
Yeah.
as well.
Yeah.
So stuff like that.
So educating, providing a sort of like taper off substitute for somebody with opioid abuse problem. Yeah, I mean, like again, can do it. Have to learn, right? Have to be likely because it's a medication. You have to be licensed to administer such medication, and there's some systemic complexities to it. But yeah, like and you gotta, again, if you start looking upstream, this is sort of covering, right, like solving the symptom of it, the immediate. So this is the immediate response. What's upstream? What's upstream from there, right? Does isolation play a role in that, right? Does sort of social stigma play a role in people not seeking help, right? And on and on and on. I mean, you can, and there's a lot to do for all of us about whatever. So if you're passionate about it, then start looking upstream and start figuring out, okay, what can I do to affect this? And again, learn. Some of it is policy change, right? Some of it has to be policy regulation change or anything like that. And how do you do that? How do you do, like, so showing up at the ballot box is just every once in a while is going to do it? No. You got to get involved. You got to get involved in policy change, and you got to drive it forward. You have to run for offices. By the way, I'll give you this: not a single nurse in the U.S. Senate. Not a single one. 4 doctors. Not a nurse. Way more doctors, and there's, I think it dropped. The number dropped after this last election. So there's 2 or 3 nurses in the House of Representatives to like 16, 20 some doctors. So we're complacent. We're not doing it, and then we're waiting for something to happen, for something better to happen. So yeah, getting involved, but for now, associations, nursing associations, find people who are like-minded, like-hearted, who want to drive change, and then start figuring it out together, right? And moving forward. Alone, it's very difficult to do. Yes?
Well, I quit here after 28 years to have a voice and to be like, you need to figure out the cause and not just the symptom. Like,
Correct.
You need to not be treated for your symptom. Like, all these doctors just want to treat you for the symptom. They don't want to find out why you're actually having these symptoms. And I want to have a voice and go in for my nurse practitioner so I can.
Awesome. Yeah. That's absolutely. So advancing in your practice, right? NPs, like family nurse practitioners, mental health nurse practitioners, I mean, they're essential. There's not nearly enough, because again, like not enough RNs choose to go into that, because it's more education, it's more school, it's more what, but if you're passionate and want to drive this, do it, right? It is needed. Nurses are needed in primary care. We're like a must in primary care, and we're a must in population like wellness, health care, emotional health, mental health, and so forth. So it's something. So like those of you who are going for PN, great. Next step then, like you're done with that, you have your license, you go to work, you start working, associates after that, right? Then you can go for bachelor's and you can go for your master's. And get to be more and more effective and contribute more and more and more, and look and work with patients, then not just treating a symptom and sort of like carrying out a doctor's order, but being able to be a prescribing authority and being able to treat and being able to prescribe treatment. So yeah, like that's awesome. Other things. Let's do it. Who else? Yes. Proper care management. Okay, tell me more.
Like being able to understand the situation the person is going through,
Right.
and being able to like kind of like educate them and
Yeah.
take care of them the proper way. Not just go and then look at them like, oh, you need ibuprofen.
Right. Okay.
Being
So.
able to like.
So it's essentially it's similar to what was said, but it is like the complexity of each human being as a human being is incredible, and the wellness and health, right? Not just physical. So it's physical, emotional, social, occupational, financial, spiritual, environmental, right? It goes on and on and on, 8 dimensions. And you have to understand all of these dimensions and how they interact within those dimensions in order to provide the most effective care for that individual and to help them navigate the environment matters, right? Like the big environment and the environment of that particular individual. Go ahead. I'm gonna go this way now, so I'm gonna get to everybody. Yes.
A little bit of feedback off of what she was saying, as like also being competent in your care and confident.
Yeah.
A lot of times, yes, nursing is about following orders and directions, but also don't just follow it to a T. Actually read it and know what you're giving, because sometimes
Yes.
it could cause an overdose
Yes.
by giving the medication, right? actually know what you're giving, what it causes, what it does,
Correct.
and what affects an outcome will be.
Competence is really, really important, right? It's again, I understand, and as I said, and the only way to gain it is to actually work on it and work on it and work on it. There is no shortcut to it. There's no anything for it. And so anytime you're, as I said, you may be inclined to kind of skip over something and say, huh? I mean, I'll give you this example. And this, you probably have seen a communication about it. Maybe it hasn't gone out yet, but we expelled 44 learners at the end of last semester for cheating, and it's like an organized, so, and the way, yeah, on their exams, and four of them were about to graduate. So, and that got caught. One of those four said she has done it, and what's the big deal? She has done it throughout the program and had no, and what's the big deal? Yeah, that is a big deal, what you're talking about. You hold other human beings' lives and well-being in your hands. So simply, just excusing it, I don't have time or whatever, delete Facebook, delete it. Say bye. I'll be MIA, 523 friends, I'll be missing in action for a while. Get rid of the distractions, focus. I know many of you work, probably all of you work, so that's all you have, Have your, whoever your partnership circle is, do laundry and things. And cook, get mom involved, get your spouse involved, whoever it is, kids, they're older, laundry. Rather than, it'll be good for you, good for them. All right, go ahead.
Yes, I sort of litigation prevention. So as a nurse working with a doctor, most likely people come for surgeries or procedures, and if anything goes wrong, they'll sue. So we as nurses, we have to give a good quality of care and also be transparent.
Right.
Explaining things to patients.
Transparency is important. Yeah, reduction of error is important, right? All of this. There are some technological tools that are coming that hopefully are going to reduce error in care delivery. AI is going to help. No, that is very true. Focusing on the human components of that, making sure you utilize your tools, and then, yeah, driving that down. All right, your turn. No? Scratching head? What are you going to do? Starting now.
No?
Yes.
We can reduce the money we pay for insurance.
Well, yeah, but you can't reduce the money you pay for insurance.
It can be reduced.
It could be, but what you're going to do, right? Everybody, I'm going to study, kind of study. Okay. You have no other answer. Tell me you're going to learn and then arrive at some answer, right, in the future, because that would be good. All right. Yes. TikTok.
I was thinking about what you just said, that a lot of nursing are not in places like government, like Senate thing, house.
Okay. So you're going to run for office.
Yeah, and teach people about how to pay.
That's great. You need to learn so much.
Yeah, explain to the people. A lot of people that don't know. They don't know.
Good.
that.
But what are you going to start now? Join an association, like Student Nurses Association, for example, can give you a good sort of catapult, and you can stay current on things and figure things out, right? Like being a part of an association, and then other associations are there, and so you can build your platform to run. All right. Hey.
One thing that I believe I will do based on our conversation today is the fact that you've enlightened us about how nurses have been burnt out and how majority of nurses quit their jobs 2 years into the profession. So as of now, taking into consideration that there is shortage of nurses also, I would encourage more people,
Okay.
especially
Yeah.
male, black male,
Awesome.
in my community to join the profession so that
Yeah.
the future can be brighter for healthcare.
Fantastic.
And not only that, I would try to get into communication with people that can come up with an association that encourages the essentials of why nurses are important and why we should treat them better.
Absolutely.
So we'll be able to stop the overload on them and make them know that they mean a lot to us. Maybe this can help with burnt out and
Right.
create more passion for
Awesome.
the practice.
Get more people into it. Get more people into it like you have to. And you know what you all have to make sure you do? Not become a statistic, but actually graduate, right? Yeah, like that takes, that takes resilience, that takes studying, that takes whatever. And then so you have to, step one, ensure you enter the profession. Yes. Step two, get everybody else educated and involved around it, right? And getting more folks into it. Again, like we have to increase the supply, otherwise we will continue like spinning the wheels and being in the same type of situations. All right. Did you tell me something already? No. Yeah. Okay.
Yeah. I think as a nurse, I really want to be part of development and policy making. Right here, as you said, we have just 4 nurses involved. Because if I am part of policy making, I'll be able to educate them.
Yeah.
And how the importance of the same and
Totally. Like so getting again and getting into the office, that's like step 33. I don't know. Like right, like before you actually can do it, but you can start small on a community level, making sure that your community is aware of you, right? Like educating the community, doing all of that, and then as you progress, as you learn and progress and kind of develop in your career, then you can likely, move it like and run for elections and doing all of that. I mean. It is absolutely true, and we're not unified in our voice either. And so kind of uniting around certain principles that I think we need to as a profession is important, and getting others subscribed and committed to that. All right, how about?
What I'm gonna do today is probably gonna start in this room by creating like a group.
Oh, awesome! Study group and like support group. That's fantastic. Yes. This. Yeah, part of self-care, part of this, creating your social support around this, it's tough, and somebody else will know what you're going through, right? Because you're going through the same thing. So that's really cool. All right, where else? Yes.
I think what I would do is I used to be really involved in, like you said, it's like 5th grade to like 8th grade. You have to expose them so they can know what opportunities are out there, and it's something I just kind of got away from. So I think that I would look back into
Going back to that, yeah, that's amazing.
Working with that age group, letting them know what's available to them.
Absolutely, that's great, fantastic. All right, who else? No, everybody's like, it's like, yes. All right.
So they said, I have a question for the speaker. Being a new nurse, building up your confidence. Do you have any suggestions on how to do that?
Building up confidence. Look, believe it or not, like I didn't roll out of like mama's womb all put together, and like kind of the way I am confident and going through that. It's work. It's learning, knowing your stuff, and being able to speak to what it is you know. So you learn it first. You know what you constantly update it, right? Somewhere there, yeah. Constantly update your knowledge, right? Nursing is a continuous learning profession. You never stop. You cannot stop. You constantly have to find new data, new evidence, constantly have to learn, right? Because things things move forward. So that gives you, when you do that, confidence builds, right? But the fact is that many of us, there's literature on that. English is not my first language, so I felt my first managerial job, I felt such an incredible imposter syndrome. I was like, I can't believe they promoted me. I'm like, what can I do? And then what did I do? I had to go and learn, right? Because they promoted me, yes, prematurely, because I was a good clinician, and then I had to go back to like business school and learn stuff. That would help me in my career. So it is, learning builds competency, and then when you're competent and you're competent and you can bounce off and you can, sometimes debate based on evidence with folks and all of this builds you up and gives you confidence, right? So like I'm not suffering from it now, but before, was even coming and having my, like, I'm gonna build a nursing school, yay. Who wants to invest? It's like that. It was kind of like that. And somebody believed in me, but like I didn't fully at that point, and I had a lot more to learn and do and whatever in order to be able to do this. So it's just, but then over time, and you have to resiliently push through it. You will make errors, you will make mistakes, you will fail a test every once in a while. You gotta figure out why that happened. Sometimes it's like too much TikTok, like literally, and then go at it again. Change your approach, learn, go at it again, and it builds over time. So you build both resilience through it, and you build the confidence through it. And so like that's that. I'll give you to kind of wrap it up, I'll give you the example that I told you I would. When I first started in nursing education 20 years ago, as soon as I started reading regulations around it and people telling me, well, this is how we do things, and this is who this is available to, and they have to be already like 4.0 and blah, blah, and like good test takers, and I'm like, why? Like, it makes no sense to me. Why is that true? They have to pass NCLEX on the first attempt. I'm like, well, I didn't. Like, I'm doing all right. I'm not great at standardized test taking, as many people aren't. And so I, went again, and I did it, and I passed, and so, and then the way schools have adapted to, because schools' quality is judged by regulators by whether or not their graduates can pass the licensing exam, the standardized exam, on the first attempt. And if they don't, it means you as a school have done a horrible job. Nothing can be further from the truth. It is not about passing it is about becoming a confident, competent, compassionate nurse. That's what it's about. And so I was like, you know what? I asked why does this policy exist? They told me because it's a good thing, and because we've always done it this way, and it protects the public. And I was like, can you show me the evidence for any of that? And obviously nobody could, so they asked me to just sit down. This was at a board of nursing meeting 20 years ago. And I was like, all right then, if nobody has the evidence to support it, I will produce the evidence to disprove it. 20 years later, we're about to publish a paper that conclusively disproves the fact that, and also illustrates that reliance on first-time pass rate policy both exacerbates the nursing shortage, because people are not allowed to graduate, people are not allowed to progress if schools think they will not pass on the first attempt, and they keep the profession undiversified. So, and ta-da, and the policy will change. It will change in the next few years across the country. And so that's, what are you gonna do? Like, that's the question. I had to build an entire nursing school and enroll like thousands of people and get them into the profession and all of that in order to show that policy doesn't make any sense. So that's, sort of, I'll leave you with that to ponder your next move and big move and whatever else happens in between. It will take some push from everybody to get across that stage. When you walk across the stage, to get the diploma, get the license, all of this. Look, there's so much talent in this room alone. 800 plus people out there as well. I mean, you are the future of nursing, of this profession, and what this profession will or will not be able to accomplish, and how it can or could not change the nation and change the communities, change families, change the world. Like, you are it. I'm relying on all of you. Like, I've done my part, continue doing it, doing this in front of you, but it's yours to drive forward. So thank you all, for you in the room, for coming here. You all out there, we're 2 minutes late. And flame forward, everybody. See ya.